So the EMN19 trial is a trial, it's a Phase II study, which is based on patients with extramedullary disease, and the treatment is Daratumumab combined with VCD, or in another words, cyborg regimen. And the study has been going on for almost 3 years now, and since the frequency or the incidence of extramedullary disease is not so frequent, it's at diagnosis it ranges around 3 to 5%, but increases at the relapses. And we were fortunate enough to have 3 countries to participate: Italy, Greece, and Turkey. And from 16 sites, we recruited 40 patients. And initially, based on the rarity of this condition, we thought that we can include first relapse patients. But then, since we started to recruit more newly diagnosed, we focused on newly diagnosed, and 2/3 of our patients are newly diagnosed, and 1/3 is first relapse who are not refractory to bortezomib. And here we are presenting for the first time our efficacy results. The previous year, presented the infectious disease and the toxicity based on the pandemic, and we didn't have any signals of that so far, and so we continued. And here the efficacy results as the primary endpoint is response. Our response rates in the global population is 77 overall response rate, but with newly diagnosed patients this goes up to 85%, but for the first relapse it drops to 50%. So with the median follow-up of 14 months, we have the median PFS, which is not reached among the newly diagnosed patients. And we have now a correlative study which focuses on circulating tumor cells in blood for all the patients. And what we have noticed was that with advance in international staging system, circulating tumor cell frequency also increases. This has been reported yesterday in another study by our Greek colleagues. And on the other hand, neither being a newly diagnosed versus a first relapse, or having a paraosseous versus real soft tissue plasmacytoma, that doesn't have an impact on the circulating tumor cell content either. And when we did the multivariate analysis, those factors which have an impact on response are the number of plasmacytomas. So this is something new, because earlier we knew that extramedullary disease is a poor prognostic feature, especially if it's soft tissue plasmacytoma. But now we are also reporting that the number is also of importance. If you have more equal to or more than 2, then this is a poor prognostic, whereas 1 to 2 is not that inferior yet. And another issue is that our results are highly comparable to another study which was completed earlier and published. The acronym is LYRA, but it encompasses the same treatment regimen, DaraVCD, but that includes patients who are both transplant eligible and ineligible, but with their follow-up is like 35 months. And their, of course, PFS is not comparable with ours yet, but the response rates for the newly diagnosed with transplant are comparable to ours. So we can conclude that this regimen for newly diagnosed patients presenting with extramedullary disease is a protocol, a treatment that can be provided safely.